Welcome to our channel. Today, we're diving into the topic of acne papules, those small, inflamed bumps on your skin that might be causing you some concern. Let's get started. Acne papules are small, raised bumps on your skin that result from excess oil, bacteria, hormones, or certain medications. Unlike other types of acne, they don't have a pus-filled tip. Instead, they appear as red, inflamed spots. A papule is less than a centimeter in size, about the width of your fingernail. These bumps can have a dome shape, be flat on top, or even have a small depression in the middle, known as an umbilicated papule. Papules can be caused by a variety of skin conditions, including contact, dermatitis, irritation, or an allergic reaction from something touching your skin. Warts, small bumps caused by the human papillomavirus, HPV, seborrheic keratosis, growths that develop a rough, wart-like appearance. Eczema, also known as atopic dermatitis, it causes patches of rough, bumpy skin. Some rarer causes of papules include adverse reactions to medications. There's also lichen planus, which is a non-contagious skin disease. Then we have psoriasis, a condition that leads to red, scaly patches on the skin. And, bug bites. In some cases, bug bites can cause papules, and if they don't improve with home treatment, it might be time to see a doctor. If you've recently started a new medication and notice papules developing, it's important to talk to your doctor. Don't stop taking your medication without consulting a healthcare professional first. In many cases, you can treat papules at home by avoiding harsh scrubbing using warm water and gentle soaps and letting the affected area breathe. For conditions like eczema, you might want to try oatmeal-based bath products and moisturize your skin twice a day with thicker creams or ointments. Topical steroids prescribed by your doctor can also be effective. While some papules can't be avoided, others can be prevented. For example, getting the varicella vaccine can help prevent chickenpox. Taking probiotics during pregnancy may prevent atopic dermatitis in your child. Keeping your skin clean and dry can help prevent certain skin infections. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more.
Let's explore some of the most common reasons papules can develop on your skin. Acne. Acne papules are a common form of acne that occurs when your skin's pores become clogged with oil, bacteria, and dead skin cells. These blockages lead to inflammation, which causes the formation of red, swollen bumps known as papules. Unlike pustules, acne papules don't have a pus-filled head. Contact dermatitis. This occurs when your skin reacts to something it comes into contact with, like certain fabrics, plants, or chemicals, leading to irritation or an allergic reaction. The result? Itchy red papules. Warts caused by the human papillomavirus, HPV. Warts are small, rough-textured papules that can appear on different parts of the body. They're often harmless but can be unsightly. Eczema, also known as atopic dermatitis, is a chronic skin condition that causes dry, itchy patches on the skin, often accompanied by papules. These bumps can be irritating and are often seen in individuals with sensitive skin. Keratosis. Pilaris, often referred to as chicken skin, leads to patches of rough, small bumps, typically on the arms, thighs, or cheeks. It occurs when keratin, a protein that protects the skin, builds up and blocks hair follicles. Molluscum contagiosum is a viral skin infection that causes small, dome-shaped papules with a dimple in the center. It's more common in children and can spread through direct contact. Less common causes of papules. In some cases, papules may be caused by less common conditions. Psoriasis. Psoriasis is a chronic autoimmune condition that results in red, scaly patches on the skin. These patches can include papules, which are often itchy and uncomfortable. Lichen planus. This is a non-contagious skin disorder that causes shiny reddish-purple papules, typically on the wrists, lower back or ankles. The exact cause is unknown, but it may be linked to immune system responses. Shingles and chickenpox. Both of these viral infections caused by the varicella zoster virus can lead to painful papules and blisters. Shingles usually affect older adults, while chickenpox is more common in children. Seborrheic keratosis. This condition involves benign skin growths that can have a rough, wart-like appearance. Papules from seborrheic keratosis are often brown or black and appear in older adults. Bug bites. Insect bites can cause papules, especially if there's an allergic reaction. In some cases, these papules can become inflamed or infected, leading to further discomfort. For most papules, especially those related to acne or minor skin irritations, home care is usually effective. This includes using gentle, non-irritating cleansers, avoiding harsh scrubbing and hot water, and keeping the affected area clean and dry. If your papules are caused by an underlying skin condition like eczema or psoriasis, your doctor may recommend specific treatments, such as topical creams or oral medication.
How common are acne papules? Acne papules are very common. Some researchers suggest that acne papules affect nearly everyone at some time during their lives. They're most common during adolescence, but adults may have them too. How do acne papules affect my body? Your face, especially your nose, chin and forehead, neck, back, chest, shoulders and upper arms are most likely to develop papules, but they may appear on other parts of your body as well. Symptoms and causes. What are the symptoms of acne papules? Papules are an inflammatory form of acne. They don't have a pus-filled tip, but they're still noticeable. They may be red, tender, painful, or irritating. What causes acne papules? Acne papules have many causes. Your oil, sebaceous glands produce too much oil. An increased presence of bacteria on your skin. An increased presence of androgens, which are a group of sex hormones. They help start puberty and play a role in reproductive health and body development. All people have androgens, but people assigned male at birth, AMAB, make more of them. Testosterone is the most common androgen. Some medications, including corticosteroids and anabolic steroids. Are acne papules contagious? Papules aren't contagious. You can't spread them to another person through skin-to-skin contact. Diagnosis and tests. How are acne papules diagnosed? Acne papules are easy to recognize visually, so you don't necessarily need a healthcare professional to diagnose them. However, your healthcare provider can diagnose and help treat acne papules during a skin exam. They may ask if you're undergoing significant stress or if you have a family history of papules, which are risk factors. If you menstruate, your healthcare provider may ask about your menstrual cycles, as the appearance of acne papules is sometimes related and may flare with your menstrual cycles. If you have severe papules, see a dermatologist for treatment. Dermatologists are doctors who specialize in conditions that affect your skin, hair, and nails. How do I get rid of acne papules? Non-prescription medications can get rid of milder cases of papules. Some medications include azelaic acid. This is a natural acid found in various grains such as barley, wheat, and rye. It kills microorganisms on your skin and reduces swelling. Benzoyl peroxide. This is available as an over-the-counter product such as Clearasil, Stridex, and Panoxyl as a leave-on gel or as a wash. It targets surface bacteria which often aggravate papules. Lower concentrations and wash formulations are less irritating to your skin. Irritation or dryness is a common side effect. Retinoids, which are vitamin A derivatives retinoids such as Retin A, Tazarac, and Differin, now available without a prescription, break up papules and help prevent clogged pores. You may notice a change in skin color, drying or peeling. Using a retinoid every other day or using it at the same time as a moisturizer can reduce these side effects. Salicylic acid. This is available over the counter for papules as a cleanser or lotion. It helps remove the top layer of damaged skin. Salicylic acid dissolves dead skin cells to prevent your hair follicles from clogging. If your acne papules don't go away with non-prescription medications, your healthcare provider may recommend the following prescription medications. Antibiotics. Your healthcare provider may prescribe antibiotic pills or tablets that you swallow with water. Effective prescriptions include a tetracycline or a macrolide. Anti-androgens. Anti-androgens block the effects of androgens, which are sex hormones that may worsen acne papules. Dapsone. This is a topical gel that has antibacterial properties. Apply dapsone to your papules twice a day. Oral contraceptives. Oral contraceptives such as estrostep, Beaz, ortho, tricycline and Yaz can help with acne papules. Are there any home remedies for acne papules? Several home remedies may help treat acne papules. While home remedies are safe for most people, it's a good idea to check with your healthcare provider before trying some of the following options. You may be at risk of developing an allergic reaction. Some home remedies include apple cider vinegar. The acetic acid in apple cider vinegar kills off bacteria, being antibacterial. If you have sensitive skin, apple cider vinegar can cause dryness and irritation, so it's a good idea to mix it with an equal amount of water. Apply a small amount of the mixture to a cotton applicator and rub it on your papules. Green tea. Wet green tea leaves have anti-inflammatory properties and can help reduce oil production in your skin. Mix dry green tea leaves with water and massage the wet leaves onto your papules in small circular motions for up to 30 seconds. Rinse your face with water when you're finished. Honey contains an enzyme called catalase, which relieves minor inflammation. Apply enough unprocessed honey to cover your papules lightly. To avoid accidentally causing a sticky mess, you can also put a bandage on top of your honey-covered papules. Ice slows down the amount of blood that flows to an area, reducing inflammation and pain. Apply an ice cube or ice pack covered in a light towel over your papules for at least 10 minutes. Apply ice to your papules up to 2 to 3 times a day. Lemon juice. The citric acid in lemon juice is antibacterial. Apply a small amount of lemon juice to a cotton applicator and rub it on your papules. Lemon juice may cause stinging or further irritation if you have sensitive skin, especially when exposed to the sun. Tea tree oil. Tea tree oil can prevent or stop the growth of bacteria. Apply a small amount of tea tree oil to a cotton applicator and rub it on your papules. Should you squeeze papules? When acne papules cause a lot of pressure under your skin, you may want to squeeze them. However, it would be best if you didn't squeeze your papules. There isn't any pus to remove, and squeezing can cause several problems. You may open your skin and introduce bacteria into the opening. Bacteria can cause an infection. You may irritate your skin. Your skin is sensitive and your nails are stronger than your skin. When you use your nails to apply a lot of pressure to your skin to try to pop a papule, you can cause inflammation. You may scar your skin. You can seriously damage your skin and cause permanent scarring if you apply too much pressure. Do papulas go away on their own? Most acne papulas go away on their own, but it may take some time, usually between 3 and 7 days, though it may take up to several weeks. How should I manage my acne papules? If you have papules, be careful managing them to avoid irritation. The following will help you avoid irritating your papules. Avoid touching or picking at them. Be careful shaving around them. Regularly clean items that touch your face, including your cell phone, sports helmets, sunglasses, clothing, and pillowcases. Prevention. How can I reduce my risk of developing acne papules? Preventing papules is difficult, if not impossible, during normal hormonal changes, but the following tips might help. Wash your face daily with warm water and a mild facial cleanser. Routinely use non-comedogenic or non-pore clogging moisturizer. You don't have to stop using makeup, but try to use non-comedogenic products and remove your makeup at the end of each day. Routinely wash your hair. Keep hair products away from your face. And lastly, keep your hands away from your face. What can I expect if I have acne papules? Papules often go away in early adulthood, though some people will continue experiencing them throughout their lives. Your healthcare provider, medical esthetician, or dermatologist can help you manage your acne papules. When should I see my healthcare provider? See your healthcare provider as soon as you notice acne papules to start treatment immediately. What questions should I ask my healthcare provider? Are my papules severe? Do I need to see a medical esthetician or dermatologist? What over-the-counter medications do you recommend? What prescription medications do you recommend? Do I need more serious treatment? What's the difference between a papule and a pustule? Acne papules are solid, inflamed bumps in your skin that don't have a white or yellow pus-filled tip. Pustules have a white or yellow pus-filled tip. Papules can develop into pustules. What's the difference between a papule and a nodule? Nodules are a more severe form of acne than papules. They're larger and more likely to be painful. What's the difference between a papule and a macule? Papules are a form of acne. Macules are smooth areas of discoloration that appear on a person's skin that may be from a variety of causes. Acne papules are a common skin condition that affects most people, especially teenagers. Because they mainly affect teenagers, many people think that papules are part of the transition from childhood to adulthood and don't see a healthcare provider about them. But a dermatologist can help treat your acne papules and limit any long-term damage to your skin.